Hi, I am Dr. Puneet Mishra. I am working as Additional Director Orthopedics and Unit Head at Fortis Hospital, Shalimar Bagh, New Delhi, India. Today I am here to share some information and knowledge about hip preservation and its role in alleviating symptoms of hip pain. So for that matter, we need to know what is a hip joint. So as you can see here, I have a model with me, and the hip joint consists of a ball of the femur and a socket-like structure, which is the acetabulum. So this ball and socket joint forms a hip joint. Every joint in the body is lined by a healthy cartilage, both on the conforming surfaces, like the ball of the femur and the socket of the acetabulum. They're lined by healthy cartilage. So what causes hip degeneration is degeneration of this healthy cartilage, which degenerates with time, and a stage comes when the hip joint cannot be preserved. Preservation means your native hip joint degenerates to an extent when pain and stiffness increases to an extent where limitation of movements become painful, and then you replace the joint. So what is joint replacement? Joint replacement is when both the socket as well as the ball of the femur is replaced by artificial prosthetic joints. This is hip replacement. So it is also important to know what are the symptoms of hip pain which one can suspect that the pathology is lying in the hip and not anywhere else. So hip pain generally is reported by the patient as groin pain or pain in the upper outer aspect of the thigh, and sometimes back pain or pain in the buttocks regions. So if a patient has pain in all these areas, there could be a possibility that the pain is arising out of the hip joint and not the spine and anywhere else. Pain in a child who is walking with a limp. Pain in a child who is not able to squat, or a child who is not able to sit cross-legged, or pain in a child who is not able to participate in sports activities, again can be due to pathology in the hip joint. So there are certain conditions in the childhood like Perthes disease, like a slipped capital femoral epiphysis. These are basically conditions which involve the ball of the femoral head in a very young age, which subsequently alter the shape of the femoral head, thereby restricting the mobility of the child in a young age. So the child presents with a painless limb, restriction of movement, stiffness of the limb, some limb length discrepancy like shortening of the affected extremity. Coming to a symptom of avascular necrosis, wherein the blood supply of the hip joint goes at par and it is affected. In these patients, these are the patients who again present with difficulty in walking, and they also present with rest pain. So rest pain, if the patient is having rest pain, means that while you are lying in bed and you're having pain in the gluteal region or in the groin region or in the thigh region. So rest aggravates the pain. So again, if this is the symptom, then you have to be very watchful for that, and you have to immediately seek the opinion of a trained orthopedic surgeon, so that you can rule out this treatable condition, because this condition by 2 to 3 years progresses to an extent where hip preservation cannot work, and young patients as early as 20 to 30 years of age, they land up with a hip replacement surgery just because their symptoms were not diagnosed early and their diagnosis got delayed. So these are the common symptoms for hip pain. Hip preservation means you are preserving your own native hip joint as long as possible, so that in young patients who are less than 60 years of age, we can prolong the joint's life by at least 10 to 15 years. And hip replacement surgery altogether may not be required, or it may be at least delayed by 10 to 15 years. Coming to young adults and patients who are in their middle age, very important condition and a very common condition is avascular necrosis, in which condition the blood vascularity of the head of the femur, the socket, the blood vascularity of this ball becomes damaged. And there are certain factors like excessive alcohol intake, smoking, excessive weight, use of steroids. So these are modifiable risk factors which cause this condition. And there are certain other factors which might be genetic in origin, which also lead to decrease in the blood vascularity of the femoral head, whereby the shape of the femoral head with time, it becomes from a spherical ball to a flattened ball. So once a flattened ball appears, so flattened ball, when it moves into the socket, it also degenerates the cartilage of the socket as well as the head, and advanced arthritis sets in. So these are again patients who, if we can diagnose them early, and we can do hip preservation surgery where their own native hip joint can be preserved, and these patients might not at all in their advanced age need a hip replacement surgery. So why am I stressing on hip preservation? Because any primary hip replacement lasts only 15 to 25 years at the best. And the primary hip replacement, which is the first hip replacement, gives you the longest life of implant longevity. So if a patient is suppose 40 years of age and you do a hip replacement, so even the best of the implants will last for around 25 years. So by the time he is 65 and if he is still active, another hip replacement, which is known as a revision hip replacement, does not last as much as a primary hip replacement. So the purpose here is, if we can do a hip preservation surgery in such a young patient and delay the hip arthritis by at least 10 to 15 years by doing a hip preservation surgery. So if this patient needs a joint replacement surgery later on, he will only require a primary or a first time hip replacement only once in his lifetime, and he can be active throughout his life as long as he is living. So the post-operative stay after a hip preservation surgery is around 3 to 5 days in the hospital. Most of the hip preservation surgery in these patients can be mobilized the very next day with a walker with the help of a physiotherapist. By the time the patient reaches 6 weeks to 2 months of post-operative follow-up, they can possibly bear full weight and resume almost complete activities by 3 months of surgical follow-up. So complete activities or return to sports activities is generally possible by 5 to 6 months of post-surgical follow-up.